me know when? Well, good afternoon, everyone. And this past week demonstrated that it is not always sunny in Philadelphia. And I think the recent rainy days may have helped encourage people to stay home. Today, though, the sun has returned. And while that's nice to see, I am concerned that some Philadelphians will view it as an invitation to leave their homes and to socialize. The sun may be shining, but the threat of the pandemic is just as strong. So I remind folks again, stay inside, please. If you do go out to get some air and exercise, do so alone and only for very short periods. Yesterday, as you know, we announced the first fatality from the virus in Philadelphia, and that is a chilling reminder of how serious this thing really is. Many of you have seen the terrifying videos of overloaded hospitals in Spain and Italy. Now New York is facing that reality. We don't want Philadelphia to be the next major city in that situation. So please, don't let the sunshine tempt you today. Stay at home. Late last night, the Senate passed a $2 trillion stimulus bill, which the House is expected to vote on tomorrow. We know that a record 3.3 million people filed for the first-time jobless benefits last week across the entire country. This situation we face is unprecedented, but I'm encouraged by what we see in the federal package that was passed last night. Not only does it include stimulus payments to individuals, but the expanded unemployment coverage would also include the self-employed to receive benefits, which they would not previously been able to access. We know that despite this federal relief, there will still be many who are unable to receive benefits, and that is devastating. Our administration will continue to seek out additional avenues of support, but I want to be realistic about the resources that we have available. As a local municipality, our resources are limited. We are focused on keeping Philadelphia's small businesses open and people employed. I know this isn't a perfect answer, and I know people want us to do more. I assure you we will continue to push for more resources and more support for our citizens. Unfortunately, I am announcing today that we have ended negotiations with the owner of Hahnemann Hospital over potential use of that shuttered facility. We need to find facilities that could contain several hundred hospital beds. The Hahnemann building is vacant, but it is also in a state of disrepair. It has been shuttered for months and has no beds. It would require extensive work in order to make it usable again. While we aren't aware of any other interested parties, the owner first wanted us to buy the building. We have no need to buy the building, nor do we have the resources to make a purchase. The owner then wanted us to pay $400,000 a month in rent, in addition to paying for improvements and expenses, all of which would total around $1 million a month. I'll let others decide whether that's reasonable or not. We offered to rent the facility for a nominal amount and pay the upkeep and expenses. That still would be hundreds of thousands of dollars a month paid by the city. This work would lead to improvements in the facility, making it more marketable for the owner in the future to sell it. Yet the owner would not agree to our offer. In the midst of a public health crisis, with the numbers of positive cases increasing daily, we simply do not have the time to continue in a lengthy negotiation. I know some have suggested that we seize the building by eminent domain. We did examine that option. It is a lengthy and complicated process under state law, and we also don't have that sort of time. Eminent domain will require us to purchase the building based on fair market value. As I said, we don't have the need to own it, nor the resources to buy it. So we are done, and we are moving on. We need to focus on the crisis at hand, including the need to develop facilities that will serve as field hospitals, as quarantine space, and as isolation space, facilities that will actually help save lives. We will focus our energies on working with other property owners in order to find temporary solutions to these absolutely vital needs. And I fully expect that we will find owners who are ready and willing to step up, to work with us, and to do what's best for all Philadelphians. Despite all that, the spirit of goodwill can still be found in abundance here in Philadelphia. For example, We've had a nice outpouring of goodwill from companies and individuals offering to donate much-needed personal protective equipment. We've had more than 150 such offers since Monday. And these offers come not just from city businesses or residents, they're coming from the suburban counties as well. People or businesses wanting to donate personal protective equipment should visit phila.gov/PPE donation. That's phila.gov/PPE donation. After people submit what they have to offer, the EOC logistics team looks at the offer to see if it's viable for use. Teams have been everywhere, from businesses to people's homes, to look at the offered material. We've confirmed at least 35 of the offers so far are equipment that is appropriate, and already about 24 donations have been received. This will quite literally help save lives. And these donations are a reminder that when it comes to people in need, residents of the city and the entire region know how to step up and meet that need. And now I'd like to ask Dr. Farley to give us his daily update.
Thank you much, Mayor. First, just the top line of what I'm going to be talking about today is that we are seeing continued growth of cases of the coronavirus infection in Philadelphia. The testing for this infection is available, but limited, and our healthcare system is still available for everyone who needs it. So more details on that. Today we report that we have 127 new cases of the coronavirus diagnosed in Philadelphia residents, bringing us to a total of 475 since the beginning of the epidemic. That 127 is of 762 test results that we received today. Now, let me talk a little bit about the numbers because some reporters have noticed a discrepancy between the numbers reported by us at the Philadelphia Health Department and the State Health Department. We ultimately have the same source of information. That's the laboratory that does the tests. But we, for these press conferences every day, cut off our numbers at 10 o'clock in the morning. And so we tend to run ahead of the State Health Department that is reporting things, I believe, from midnight the night before. So our numbers will always be slightly different. We will tend to be a little bit ahead of them and in terms of our total count. And the numbers I'm reporting here today are the numbers that we at the Philadelphia Health Department will continue to follow. Of that 475 people total who have been reported with this infection, there were 18 under the age of 20, 216 between the ages of 20 and 39, 126 between the ages of 40 and 59, and 115 over the age of 60. Of that group, 40 were known to be hospitalized, and 44 are known to be healthcare workers. Yesterday, we reported the first death in a Philadelphia resident. Sadly, today, we do not have any additional deaths to report. A reminder about the availability of testing. Many people want to be tested. Testing is available through most hospitals in the city. There are more than 20 sites, but the testing is limited by the test kits and the availability of protective equipment. Most hospitals have a system set up where it's by referral from their own healthcare provider, and they're using criteria for who it is appropriate to test. There's guidance at our website about whether you need a test, and if so, how to get it. The testing site at Citizens Bank Park will be open today from 1 p.m. to 6 p.m. This is for people who are over the age of 50 or healthcare workers who have symptoms characteristic of the coronavirus, be respiratory symptoms plus fever. I was asked the other day by a reporter how many of the tests from this site were positive. There is a several-day delay before we get the results. We have the results from the first 59 people who were tested at that site, and one of that 59, only one of that 59 tested positive. Reminder to everyone that as we get an increasing number of cases, there will be more and more cases of employees at workplaces that test positive. We have guidance on our website about how employers can handle that situation to protect other workers. I want to remind everybody again what the mayor just said. To stay safe, as these cases rise, the risk increases to everyone in the city of Philadelphia. Each day it becomes even more important to follow our stay-at-home order. So now is not the time to be getting in contact with people. Keep your distance up to 6 feet. Wash your hands. And while you're inside, spending those long times indoors, it may be a little difficult for people. That's a time to call your friends, call your relatives, do a video chat. You can stay in contact with people without getting yourself at risk of passing on or getting the infection. Now, for those people who do develop symptoms, if you're sick with a fever and respiratory symptoms, first of all, stay away from others. If you must go out, for example, to receive medical care, wear a mask so that you don't expose others. An increasing number of people are going to be asking the question about whether they should get medical care with those sort of symptoms. The Centers for Disease Control has a wonderful website that they put up called What Do You Do If You're Sick? That provides great information on how to do it. It includes a self-checker where there are questions, and you can respond to the questions that are asked of you, and at the end it'll give you specific advice about what you should do about your specific situation. I encourage everyone to use that. Some general principles, though, is that if you are having the symptoms I'm about to give you, then you need to get medical care right away. So if you're having increasing trouble breathing, if you are feeling persistent pain or pressure in your chest, if you or someone that you are with is experiencing more confusion or you're unable to arouse that person, or if a person has bluish lips or around the face, that is a sign of not getting enough oxygen. Any of those symptoms are signs that this infection may be getting severe. In those cases, you should seek medical care right away. If you have medical questions, remember we have a line you can call 24 hours a day, 7 days a week, 1-800-722-7112, and a medical professional will give you advice as to whether you need to talk to a doctor or a nurse. For people who need medical care, I want to remind people that hospitals at the moment are not seeing an increased number of patients. They are certainly available for you. So don't hesitate to go to the hospital if you are having those severe symptoms and you need to receive care. Reminder also, speaking of medical facilities, that we do not want to introduce this infection into our medical facilities where there are vulnerable patients. That includes nursing homes and includes hospitals. We made the recommendation the other day that nursing homes should have a no-visitor policy so that visitors do not bring the infection in and expose the very vulnerable residents in nursing homes. Many hospitals also have either a no-visitor policy or a very strict visitor policy. I understand that that's difficult for many people. They want to visit their relatives who are in the hospital, but it's particularly important that we protect those patients who are the most vulnerable. So please follow those no-visitor policies. Just a reminder that we made a recommendation yesterday that people who are arriving in Philadelphia from New York City self-quarantine for 14 days after the last time they were in New York City. That is because the number of cases that are being diagnosed in New York City is very large. We know the infection is spreading very rapidly in that city. Most people are welcome here in Philadelphia, but we don't want you to bring the infection to others here in the city. So that means you be particularly strict after you arrive in Philadelphia. Stay home. Don't go outside. When you need food, have food delivered to you. Have other people support you from the outside for 14 days after the last time you were in New York City. Again, if you want to help this, if you're a retired medical professional or anyone else who wants to volunteer, www.phila.gov/MRC. And if you want more information on a variety of topics that I mentioned here, our website is www.phila.gov/COVID. Thanks.
Muy buenas tardes, mi nombre es Joana Otero Cruz, la subdirectora de Servicios Comunitarios aquí en la ciudad de Filadelfia. Hoy voy a compartir la actualización en material de salud, hoy día 26 de marzo 2020. Última información sobre el COVID-19 en Filadelfia. Seguimos viendo aumentar los casos positivos de COVID-19. Las pruebas están disponibles, pero limitadas. El sistema de atención médica está disponible para todos los que lo necesiten, independientemente del idioma que hablen, si tiene seguro o no, y su estatus migratorio. Desde ayer a la 1 de la tarde se han confirmado 127 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 475 casos confirmados. La tendencia es que los casos sigan aumentando rápidamente. Los detalles que podemos compartir sobre los casos son los siguientes. 18 personas menos de 20 años, 216 personas entre los 20 a 39 años, 126 personas entre los 40 y 59 años, 115 personas mayores de la edad de 60 años, 40 personas están hospitalizadas. 44 son trabajadores del sector de salud. Ayer se mencionó que una persona había fallecido y hoy no tenemos nuevos casos para confirmar. Las pruebas están disponibles en la mayoría de los hospitales. La mayoría de las pruebas son para personas que tienen síntomas, son trabajadores de salud o tienen más de 50 años. Los resultados son reportados entre 2 y 6 días. Hemos publicado orientación sobre qué debe realizar pruebas de coronavirus en el sitio web COVID de la ciudad. Sobre el centro de pruebas en Citizens Bank Park, está abierto hoy de 1 a las 6 de la tarde. Los casos aumentarán. Todos debemos hacer lo necesario para estar sanos. Si no eres un empleado esencial, quédese en su casa. Si debe salir a trabajar, les recomendamos mantenga distancia social de 6 pies, lávese las manos. Si está enfermo con fiebre o problemas respiratorios, por favor, manténgase lejos de otras personas. Si debe salir por una emergencia, use una máscara. Si presenta los siguientes síntomas, debe buscar atención médica inmediatamente. Problemas de respirar, como fatiga, dolor fuerte o presión en el pecho, confusión o incapacidad para despertar, labios o cara que tornen azules. Los hospitales están preparados para el incremento de los casos. Podemos atender a las personas que necesiten cuidado médico. Haremos todo lo posible por cuidar a nuestra gente. Queremos hacer un breve recordatorio. Si ha viajado al área metropolitana de Nueva York, los recomendamos que cuide cuarentena por 14 días de su visita. Si quieres ayudar, necesitamos voluntarios. Ingrese al sitio web fila.gov/mrc. Tenemos actualmente 900 voluntarios. No olviden consultar el sitio web para mayor información, fila.gov/COVID. Recuerde que debe llamar al 311 si tienes preguntas sobre el COVID-19. Tenemos servicios de traducción en 100 idiomas, respuestas y preguntas médicas las 24 horas, 7 días a la semana. Llame, por favor, al 1-800-722-7112. Ahora para preguntas. Questions?
Portion for members of the media. Please remember we have a limited time during these briefings, so if you could please limit your questions to the 1 to 3 most important. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We're going to unmute you one by one to answer your questions. First up, we have Pat Loeb with KYW. Go ahead, Pat. Pat, can we hear you? Okay, one sec. We will try someone else. Okay, Martin Pratt with Philly YBN. If you all could just hold, we're having some technical difficulties. We're going to go to Martin Pratt again. You've been unmuted.
Can you hear me?
Yes.
Okay, cool. Excellent. I want to say thank you to everyone for this press conference. And I want to tell you, as I talk to reporters around the country, Philadelphia is one of the few places that's doing this to journalists. So thank you so much for doing this, Mayor and Brian, and everybody has helped put this together daily. My questions are, based on what probably will be a stimulus package, has there been any thought to allowing reopening of libraries, because there are a lot of people that may not have access to a computer and may not be able to apply for unemployment at home or on their mobile phone? That's one. And the second question is there any possibility or thought been given to giving people access to food stamps early?
So on your first question, I think it's something that we're taking under consideration. I think we're trying to balance the social distance needs as well as how do we make sure people have access. And so we do have a group of staff reviewing what will be available to individuals and how best to access that. So I don't have a specific answer for you today. And could you repeat your second question as well?
Food benefits for those experiencing food insecurity. Are they going to be allowed to get access to their food benefits early than their normal date?
So we are in conversations with the governor's office to make sure that that process is streamlined. And my understanding is they have made a number of regulatory changes to help with that. We'll have to get back to you with details, though.
Thank you so much.
Of course.
Okay, we're going to try to go back to Pat Loeb again. You are now unmuted.
Thanks, Kelly. Can you hear me now?
Yes.
Okay. I was interested in what other facilities, the mayor said you're not working with Hahnemann's owner anymore, but you're looking at other properties. How many, and are there any other agreements?
Thanks, Pat. We are working with a number of other, mostly hotels. We're around 5 or 6 for a total of 800 plus rooms. We're in various stages of negotiation with those, and certainly when we get to a closer point, and depending on the disposition of the landlord, we may be able to make announcements later down the line.
Okay. And City Council passed the $85 million package that you had requested today. Do you anticipate needing more than that? And also part of that money will be for the Small Business Fund. And I just wanted to confirm a number that Cheryl Parker gave, that 1,720 people had already applied for that program? Or small business, rather?
We don't know what the final number is going to be. It's likely we'll have to go back for some more. We thought that this was an appropriate number to address the initial impacts of the dilemma. But right now there are 1,800 applications for the small. There are 1,150 applications are for micro businesses, and 600 are small businesses. So we're trying to address the small business issue. The third tier, there's about 60 loan requests right now for loans to somewhat larger businesses. So we're, again, this is new, and we're going through it, and we'll make adjustments as we need to correct things. And if we have to come back to council for additional dollars, we will. And we're just, again, this is a day by day, week by week process.
Thank you.
Okay, next up we have Laura McChrystal with the Inquirer. You are now unmuted.
Hi, I am hoping to clarify. I know that, the one hotel the city has already secured and also the Hahnemann facility when that was under negotiation, had been intended for quarantine space. I'm wondering if the city is also trying to secure any surge hospital space. And would that be at those hotels and somewhere else? And also, has the city, I know cities elsewhere around the world have tried to obtain space to use as a morgue if needed. I'm wondering about that as well.
So We are looking for both quarantine and isolation space. Quarantine space would be for those individuals who have been in contact with someone who has the virus but are not showing symptoms or haven't been tested positive. Isolation space would be for those people who are showing symptoms and or have tested positive, and those sites are what we are currently in negotiation. For surge hospital space, we are in conversations with PEMA in order to bring in some additional federal resources to help us stand up some surge hospital space. And we are in consideration of whether we have some discharge space available for hospitals for those who may be on the mend and can free up beds. We are not quite there yet, but that is certainly in the planning stages. As far as morgue space, we certainly are aware that New York City has brought in a number of refrigerator trucks in order to prepare, and we are taking similar precautions and preparedness at the same time.
Thanks.
Okay, next up we have Manny Smith with CBS 3. You are now unmuted.
We have two questions today. The first one is probably for the health commissioner. And there were reports yesterday, the dean of Penn Medicine on a national news program kind of talking about Penn Medicine's modeling for coronavirus and saying that they predict that the tsunami of cases may hit Philadelphia in mid-May and have about 1,000 ventilators 1,000 patients on ventilators at that point. Is that something they've shared with the city? And are you guys predicting that same type of wave at that same timing or any time in between? And my second question today is that we are following some new data showing a lot of people using bikes and taking advantage of the city's parks and trails. And we want to know if you guys have any concerns about self-distancing or people pacing themselves out while they use it.
Yeah, so the model that you were mentioning that was done by the University of Pennsylvania Medicine Department is one of many models that's out there to predict what's going to happen with this epidemic. We have looked at it. It's available publicly on the web. I can tell you that there's tremendous uncertainty to any model, and so I wouldn't put much stock in any specific number. But all those models do predict that we will have an epidemic wave, and that the most important thing we can do to slow that epidemic wave is the social distancing that we're doing right now. And that if we do that very well, we can really reduce the peak of that wave and reduce the demand on our healthcare system. So anyone can look at the numbers on that, but again, the uncertainty is key, and the value of social distancing is the most important lesson. To your second question, our message to people is clear: stay home. However, we have said it is okay for people to go out to exercise and come right back. I am not concerned with people who are riding a bicycle on their own, coming back immediately to their workplace, or walking on their own, coming back immediately to their home, rather. The key is that they stay 6 feet away from other people. If we see people walking in groups or interacting with each other in groups, that's not good for them. It's not good for the city as a whole, and we're going to greatly discourage that.
On that model data, is that available on the Department of Health website, or where would that be?
Go through the University of Pennsylvania School of Medicine. It's not our model; it's their model.
Okay, thank you. And you guys are clearly, are you guys agreeing that there could be 1,000 patients at one point in the city of Philadelphia, all on ventilators?
There's no way that we could predict any number like that. If you see this model, that slight changes in the assumptions built into the model can make huge differences in the number of people that one would estimate would need a ventilator at peak. So we're at no level of certainty whatsoever. And we hope that everything we're doing prevents a peak of beyond the capacity we have. That's why we keep hammering home that social distancing message.
Thank you.
Okay, next we have Marco Serino with PLS Reporter. You are now unmuted.
Good afternoon. I wanted to follow up on something that had been mentioned earlier today by Council President Derek Clark. He sounded very exasperated with the fact that he says he's going around the neighborhoods and people aren't really practicing social distancing. Have there been any efforts to sort of do more groundwork if that's all feasible, or other social media channels to just gently remind people, hey, keep social distancing, things are getting worse?
Daily reminders at this press conference and any other methods that we have, along with police, engaging with people in a respectful way to explain to them that this is really dangerous for them and for their loved ones and for the city as a whole. Again, as I said yesterday at yesterday's press conference, China is a totalitarian country and have the ability to tell people and force people to be in. This is a democracy, and we love the fact that it's a democracy, but people need to be reminded and chided and explained why they need to change their behavior. But that's basically all we can do, and continue to try to get as many people to cooperate as possible. And it's frustrating for the council president. It's frustrating for all of us when we see it, and days like this don't make it easier.
Okay. I also saw that there is discussion in Harrisburg to reopen the state liquor stores and offer potentially either curbside pickup or delivery service. What's the city's response to those?
I mean, it's their state operations. The governor's in control of that. If they operate it's the same as takeout, pick up, grab and go food, probably, unless Doc's got another view. I don't see it any different than picking up a bag of burgers at the door without going into a place and engaging with people. So according to how they want to operate it, we'll tell whether or not we think it's appropriate. But again, they're state-run operations, and we have very little control.
Okay, thank you.
Next, we have Layla Jones with Billy Penn. You are now unmuted.
Hi, I have two questions. The first is, what was that working short link for the PPE donations? We tried the one that was said and it didn't work. And my second question is, what city resources are available for people who might be granted early release from state road, but are coming back into a gutted community and a stay-at-home order?
So on the resources for those returning, I think we are doing our best to make sure that they have access to food and shelter, and making sure that we're connecting them to the social networks they need upon release. Depending on how rapid that release gets, will depend on how much resources we have available. But we certainly recognize that challenge, and it's something that we're currently working on.
It's my understanding that the website is working now, and it's phila.gov/PPE donation. It's my understanding. We had a little glitch in the beginning, but now it's up and running.
Okay, next we're going to A.D. Amorosi. You are now unmuted.
Good afternoon. I'm curious, two questions. Number one, where does the city stand in its negotiations with the owner and operator of the Hahnemann Hospital space?
Negotiations have ended. We're not successful, and we're moving on.
Are there opportunities to look at additional medical centers and hospitals that are no longer in use? Like the Oxford Hospital in Lonsdale?
So I think any medical facility that's no longer in use, like any building that has been mothballed for any significant period of time, is going to need significant systems work, significant repairs and renovations. Frankly, we're spending our time looking at facilities that are as turnkey as possible in order to get folks in as quickly as possible.
Thank you.
Okay, next we are going to Jack Tomczyk with Metro.
Yes, this question's probably for Mr. Abernathy. City Council approved that $85 million in funding. What will that money be used
That money will be used for a variety of things, and so certainly it'll be used for staffing, for essential personnel. It'll be used for the purchase of equipment, so things like PPE, vehicles, anything that we may need that were unexpected. Will also that is the money that will be used for the leasing of additional sites. So again, this is unusual times for us, and I think I want to really say thank you to our city council members for being understanding that this is not a transfer or appropriations where we can be as specific as they're used to, but they've given us tremendous flexibility. We will certainly be reporting back to them on a regular basis, but this is not, I can't tell you today that I'm not going to need something different tomorrow, because that is likely going to happen, and we need to have the flexibility in order to respond to the crisis in real time.
And one more question. The mayor talked about the PPE donations. Where have those? Where is that PPE gone? Is that going to hospitals, testing sites, and how substantial have those donations been? How much PPE, I guess, has been donated?
So I can't get into the detail of exactly what we've received or how much of each of those various types of PPE we've received, but it's going to go to various needs. Some needs will go directly to hospitals, some will go to healthcare providers or their testing facilities, some will go to first responders, and some will go to some of our social service providers. And so, there is plenty of need throughout the community for PPE. Different activities will need various levels of PPE. Certainly a doctor working in an emergency room needs a different level of protection than some of our other employees, but we want to make sure that we are providing the best level of protection that we can, given the tremendous shortages we're facing.
Okay, thank you.
Okay, now we have Denise Clay. You are now unmuted.
Hi. Two questions. One, when you're talking about looking at other sites, are you contacting the colleges? Seeing as all the students had to clear out because most of the learning is being done online, are those facilities that you're possibly looking into? And also, I'll come back to my other question because I just forgot it. But could you answer that one, the first one for me? Please?
Certainly. So we're talking to a number of property owners, colleges included. What we need for quarantine and isolation space is very specific. It needs to be a single room with a bathroom and a shower. A number of dorms in the area don't fit that bill, and a number of dorms also still have students living in them that couldn't return home. Certainly under consideration and something we'll continue to explore, and really appreciate the partnership that our higher education partners have provided.
And in terms of correctional facilities, has the status of any coronavirus positives changed? Because I know that the last couple times we asked, there hadn't been any. Has that changed?
To my knowledge, no. We still don't have any positive cases in our jail.
Okay, we have one more question from Martin Pratt at Philly YBN.
Hi, really quick. I'm not sure, I missed the conference yesterday. Was there an update about the date that the students were receiving their computers that are being ordered, or has that changed at all?
There's no specific date. They're working diligently at the school district to do an inventory of all the equipment that they have in hand already, and then figure out how much more they need to buy and where they need to buy it from. So they're moving quickly. They're moving as fast as they can, but it is a quick pace. They understand the need for it, and we'll get that equipment in the kids' hands as soon as possible.
Thank you.
Thanks.
Okay, we are now going to unmute Brian Mendoza with NBC 10 Telemundo.
This is actually a question for Dr. Farley for NBC 10, and hopefully we can get it answered in Spanish later. Dr. Farley, we've been hearing that New Yorkers are taking Amtrak, Bolt buses, or simply just driving down to Philly to come to our hospitals or care since New York City hospitals are overloaded. Are you able to confirm this, if this is actually happening? And if so, how is the city responding to care not only for residents, but also the visitors?
I have not heard that. Certainly people have the freedom to move around, and we just want to be clear that when people come here from New York City that they should stay in quarantine. This infection is everywhere. We can't prevent that, but if we follow that step, then we're going to be protecting those people as well as people who are already here.
Okay. And if there's no other English questions, I guess we can answer that in Spanish if we can.
Sin repetir la pregunta.
Hemos escuchado que personas de Nueva York han llegado a la ciudad de Filadelfia mediante Amtrak, mediante buses o tal vez simplemente manejando ellos mismos para poder llegar a un hospital y que se les dé esa asistencia médica que necesitan. ¿Se puede confirmar esto? Y si esto está ocurriendo, ¿qué se está haciendo para darle servicio no solamente a los residentes, sino a los que vienen de visita de otras ciudades como Nueva York?
El doctor confirmó que no ha escuchado eso, o sea que no puede confirmar que las personas están llegando de Nueva York, pero obviamente ellos tienen la libertad de trasladarse aquí a Filadelfia y sí tenemos que proveer cuidado, pero él está recomendando que si están viniendo de Nueva York, que se queden en una cuarentena por los primeros 14 días.
Listo, muchas gracias. La próxima pregunta es, sé que el alcalde mencionó acerca de que las negociaciones con Hanneman ya se acabaron, o sea, no hay ningún contrato que se hizo. Pero si podía repetir nuevamente en español el por qué ya no están negociando con Hanneman, el costo que estaban tratando de ellos cobrar.
Sí. This question is for you. He wants us to repeat the question, your answer actually to the question of why negotiations stopped with Hanneman.
Because the owner of Hahnemann Hospital is requesting money that we could not afford to pay. They wanted us to buy the hospital at the beginning, and we don't need to buy a hospital. We don't want a hospital. And the monthly charges, the monthly rent, along with the expenses, was $1 million a month, and we can't afford that. So we decided rather than continue this dance with him, we decided to say no, thank you, and move on.
Desafortunadamente, el dueño del hospital quería que la ciudad comprara el hogar y no estamos en una posición que necesitamos comprar un hogar, solamente alquilar un hogar. Y la cantidad de plata que él quería cobrar para alquilar el hogar y todo para las reparaciones que se necesitan para poder funcionar en ese hogar estaba muy alto, más de miles de dólares mensual, y era absurdo. Así es que en lugar de seguir negociando con una persona que lamentablemente no quiere trabajar con nosotros, paramos las conversaciones.
Listo. Y la última pregunta es, ¿qué la ciudad está haciendo en cuanto al desempleo? Se han reportado desde el 15 de marzo hasta ahora, se han reportado casi 700,000 solicitudes de desempleo. ¿Cómo la ciudad está trabajando esto, tal vez para ayudar a aquellos que no tengan trabajo?
How are we helping those who've already filed for unemployment in the upwards of 700,000 plus to date?
Sí, o sea, pero ¿es algo que la ciudad está haciendo o cómo están lidiando con estas personas que se han quedado sin trabajo?
He specifically is asking, are we doing anything to help those individuals who are now unemployed?
Need to find help.
Todavía estamos en ese proceso de tratar de conseguir apoyo para todos los que se están quedando desempleados.
Listo.
Okay, we have Perla Lara from Impacto Latina. You're now unmuted.
Gracias. Hola, Joana. Hola también al
Hola, Perla.
Pues nada, tú sabes que nuestra comunidad es una comunidad bien echada para adelante y ya varios me han preguntado cómo pueden ayudar. Nuestros inmigrantes, sobre todo indocumentados, que se encuentran también sin trabajo, como es gente muy trabajadora, ha logrado ahorrar, aunque ellos no tienen ningún tipo de subsidio ni de ayuda, pero muchos se han acercado a saber cómo es que pueden ayudar en algún centro que ustedes estén especialmente pues necesitando ayuda.
Sí, para las personas que quieren ser voluntarios, pueden visitar a nuestra web, fila.gov, COVID-19, y también pueden visitar a fila.gov, MRC, para ser voluntarios.
¿Qué tipo de voluntarios necesitan? Porque nos han preguntado.
Precisamente ahora estamos buscando, perdón.
¿Qué es lo que están buscando?
Precisamente estamos buscando ahora voluntarios que pueden ayudar en los centros de médicos que se están desarrollando ahora en diferentes partes para las pruebas. Tanto médicos y personas también civiles que pueden ayudar con diferentes aspectos en los centros.
Sí, porque bueno, pues se habla de que obviamente necesitan también gente profesional, pero la gente que tiene pocas destrezas, digamos, ¿en qué podrían ayudar? Específicamente, ¿qué es la ayuda que están necesitando?
Dr. Farley, this question for you with regards to the volunteers at the different locations of the medical, where they're doing the testing. What kinds of skills are you looking for?
Could be medical skills, or it could be people who could simply record information.
Pueden ser personas que tienen destrezas médicas, pero también personas que pueden ayudar con el aspecto administrativo, como tomar notas y también completar las formularias y la data que se necesita.
¿O traductores también?
Are we in need of translators? No puede confirmar, pero tal vez se pueden utilizar.
Bueno, y otra vez lo mismo de siempre. Sabemos de que la voluntad del gobierno de Filadelfia es ayudar a todos sin distinguir documentados o indocumentados. Pero ¿qué tan realista es que se reciba esta ayuda? Sabemos que a nivel federal no nos van a ayudar. A nivel estatal no hay programas todavía que lo estén realmente considerando en serio. ¿Qué es lo que la ciudad ha pensado para ayudar a la gente indocumentada que pues no va a tener acceso a otro tipo de ayudas a nivel estatal y federal? ¿Qué está pensando?
Actualmente lo que tenemos ya desarrollado es para las pequeñas empresas. Sabemos y reconocemos que muchos de los inmigrantes tienen negocios, tienen sus empresas, y tenemos ahora mismo disponibles las diferentes becas y también préstamos de cero interés. Sabemos que todavía necesitamos mucho apoyo para muchas más personas y todavía se está desarrollando más profundamente diferentes planes a ver cómo podemos llegar a ayudar a más personas.
Última pregunta respecto a los voluntarios, porque me textearon. Si son personas que no tienen, por ejemplo, que tienen conocimiento de enfermería, pero que no tienen sus documentos avalados aquí en Estados Unidos, que no tienen ese documento que los avala aquí como enfermeros, o que tienen estudios médicos, pero que no han sido legalizados en los Estados Unidos, ¿pueden servir como voluntarios?
Dr. Farley, it's a question for you. For those individuals that may be nurses or, have some type of medical professions in their home country, but don't have them, certified here, are they able to help and volunteer?
So we would welcome anybody with medical skills to volunteer for the Medical Reserve Corps. If they are in medical roles, they would need to be credentialed by the institution that's employing them. So we may or may not be able to put them in medical roles, but we welcome those skills and might be able to use them in other roles.
Nosotros le damos la bienvenida a todo el mundo que pueda ser voluntario, dependiendo si la persona tiene créditos en su país. Se tienen que evaluar a ver si se pueden implementar aquí con la agencia que esté trabajando con ellos, pero tal vez si no pueden utilizar esa destreza como médico o enfermera, tal vez se pueden utilizar en otras diferentes facetas.
Gracias, es todo.
Okay, and our final question today comes from Mike D'Onofrio at the Tribune. You're now unmuted.
Hey, thanks. Just, I think, two quick questions here. City Council, right, advanced that $85 million emergency transfer bill today for final approval next week, but I'm sure you know by now, obviously, members tacked on $400K in an amendment for themselves to aid in the fight. Do you, I guess the mayor, do you support that amendment?
Well, I support what we needed to do to get the appropriations passed, which we did. They had some issue. They had some need for some additional money for, I think, for public service announcements and the like. And as far as their request to kind of monitor what we're spending it on, I think it's appropriate, and it's what their part of what their role is in this whole government.
All right, then just lastly, do you think your administration needs help getting the message out about the coronavirus, about updates, about?
Well, obviously, if we have people still congregating in groups and not necessarily heeding what we're saying, as much information as possible out there, it would be necessary.
All right, that's all I got.
Okay, thank you.